Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. These cells, known as cancer cells, have the ability to invade and destroy nearby tissues and organs, and can also spread to other parts of the body through the bloodstream or lymphatic system. Cancer is a qualifying condition for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to cancer and its treatment. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Major health organizations acknowledge cannabis for its potential for managing specific symptoms and side effects of cancer treatment. 2 synthetic cannabinoid drugs, dronabinol aka Marinol and Nabil-1 aka Sesamet, are approved by the U.S. Food and Drug Administration to treat nausea and vomiting from chemotherapy. Clinical evidence, though still limited, suggests cannabis can help with chemotherapy-induced nausea and vomiting. Studies show that cannabis and cannabinoids may help improve nausea that is resistant to standard antiemetic treatments. Pain relief. Some research indicates cannabis is effective for cancer-related and nerve pain. Loss of appetite. The ability of cannabinoids to stimulate appetite can help cancer patients experiencing cachexia or anorexia. And anxiety and sleep. Cannabis may also help improve mood, reduce anxiety, and improve sleep quality. Interactions with immunotherapy. Some observational studies have shown that cannabis use may make immunotherapy treatments less effective. Therefore, it is important to talk to your healthcare provider. It is crucial for cancer patients to have an open, non-judgmental conversation with their cancer care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Avoid cannabis as a sole cancer treatment. The American Society for Clinical Oncology strongly recommends against using cannabis as a standalone cancer treatment. It should not be used to replace conventional cancer therapies unless in the context of a clinical trial. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. Let's explore the recommended terpenes, cannabinoids and strains helpful for treating the symptoms and side effects of cancer treatment. Limonene. Studies show limonene can inhibit tumor growth and induce programmed cancer cell death, apoptosis. It has shown promise against breast, lung, and pancreatic cancers in preclinical studies. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. As a cannabinoid receptor, CB2, agonist, it has anti-inflammatory and pain-relieving effects. Research indicates it may slow cancer cell proliferation and inhibit tumor growth by targeting pathways like NF-kappa B. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. Linalool may inhibit cancer cell growth and promote apoptosis. It also has antioxidant properties that can reduce cellular damage. Examples of strains high in linalool include Do-si-dos, lavender, Skittles, Granddaddy Purple, Amnesia Haze. Myrcene. This terpene has demonstrated anti-inflammatory and antioxidant effects. Studies suggest it could suppress tumor growth and improve the effectiveness of other anti-cancer treatments. Examples of strains high in myrcene include Blue Dream, Granddaddy Purple, Grape Ape, White Widow, and Tangy. Pinene, alpha, and beta. Possesses anti-inflammatory, antimicrobial, and anti-cancer properties. It has been studied for its ability to inhibit cancer cell migration and growth. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Strawberry Cough. Studies and real-world data suggest that cannabis products, especially those high in delta-9 THC and CBD, can be effective in reducing nausea, sometimes even more so than standard medications. Research is ongoing to investigate cannabinoids and their potential anti-cancer effects. Cannabidiol, CBD, a non-psychoactive cannabinoid that is being studied for its potential to help manage symptoms like pain, anxiety, and sleep problems. Preclinical lab studies have shown some anti-tumor effects, but this has not been confirmed in human trials. Cannabigerol, CBG, a lesser-known cannabinoid, CBG has shown potential in preliminary studies for alleviating pain and inflammation in cancer. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.